If you're switching to Medicare this year, how much can you put in your health savings account without creating a tax problem for yourself? Now, this is a very important question, and it's one I get asked a lot. So I'm going to share the answer to that question in today's video, exactly how much you could put into the health savings account. But let's start by talking about how much you could put in total, when you should think about stopping contributions to the health savings account, and then what amount can you put in the health savings account. So first of all, the amount that you could put into the health savings account in total is $8,550 if you're on a family plan. That means the plan covers you and one other person in your household, maybe your spouse, maybe one of your children. If you're on a plan that covers only you, then the limit for an individual is $4,300. You could put that much into your health savings account. If you're 55 and above, you can add another $1,000 as a catch-up. And if your spouse is also 55 or above, they can add another $1,000 to the health savings account as a catch-up, as long as they have their own health savings account. So you and your spouse could be covered by one insurance policy. That's a family plan. You get the family limit, $8,550. And if you both have a health savings account, you could each put $1,000 in. So $10,550. Now, if you're going to turn 65 this year, then you cannot contribute to the health savings account if you go on Medicare at age 65. If you're going to stay on your company plan, you're going to opt out of switching over to Medicare because you're going to continue to work and you're going to stay on that company plan that is a creditable plan, credible coverage, then you can continue to contribute to the health savings account until you retire and switch to Medicare at that time. So you've got to make a decision as to, are you going to stay on a company plan? But if you're no longer working, then you're going to go on Medicare at age 65. That means that you have to stop making contributions at 64 and 11 months. Because when you turn 65, you cannot put any more money into the health savings account. You'll be on Medicare at that point. Let's say, though, that you did continue working and you're now 67 or 68 or 69 and you're going to retire and you're going to switch at this later age from your company plan to Medicare. It's important to understand that when you make that switch and you're over age 65, the Medicare will give you 6 months back coverage. And that means you have to stop the health savings account contribution 6 months before you're going to switch to Medicare. Now, if you're retiring at 65 in 3 months, they'll only give you 3 months back coverage because they never go earlier than age 65 with that Medicare coverage. That's the earliest that you can qualify. So that's how the rules work. You can put into the health savings account as long as you're on a high deductible health plan. You're not on Medicare yet, but as soon as you're going to be switching to Medicare, any month that you will be covered by Medicare, you cannot put into the health savings account for that month. That then means that you've got to consider, when you're thinking about this year's contributions, which months will you be on the high deductible health plan and which months will you be on Medicare? And you have to prorate your contribution based on that. So in this example, let's say that you're going to turn 65 in July. So the first 6 months of the year, you're going to be under 65. The last 6 months of the year, you're going to be 65 and above, and you're going to be covered by Medicare. You can put into the health savings account then 1/2 of the annual limit, because that's the first half of the year that you're under 65. And you're not allowed to contribute any amount that would apply to the second half of the year because you're going to be over 65 and on Medicare at that point in time. Let's say that you're married to somebody that's going to turn 65 next year. They're going to be under 65 the full year. And you're on this plan that covers both of you. So you're able to do that family maximum for that first 6 months of the year. So you get half of the family maximum. The second 6 months of the year, your spouse can get half of the individual limit, and you add those two together. So half of $8,550 for the first half of the year, half of $4,300 for the second half of the year. That is your prorated contribution limit for the year. You can still put in your catch-up contribution prorated for the number of months that you're under 65. So the catch-up contribution is $1,000. In this example, you're under 65 for the first half of the year, so you can put in half of that catch-up contribution. You can put $500 in. Your spouse, if they have their own health savings account, can put in the full catch-up contribution because they're going to be under 65 for the full year, so they can put the full $1,000 in. So between the two of you, you could get $1,500 of catch-up contribution for this year in this example. It's important to think through that. Make sure that you know how the timing works and get the right amount into the health savings account. I do encourage you to maximize the amount that you put in there, even in this last year, because all of the money in that health savings account will grow tax-free. And when you pull it out to use it for qualified medical expenses, you get to pull it out tax-free. Not only that, you get the tax deduction this year for however much you can get in. And so that is one of the absolute best ways to save money for retirement. And I wanted you to understand how you can get the most in this transition year. If you have any questions, shoot me an email. I'll be happy to try and answer them. And with that, I want you to be on your best path in retirement.